Hello, I'm Darlene. I'm going to discuss the symptoms of psychotic disorders due to medical conditions, and also I will discuss the causes of psychotic disorders due to medical conditions, functional causes, general medical conditions, psychoactive drugs, a stress response, and also postpartum psychosis. Let's start with symptoms of psychotic disorders due to medical conditions. First, what is delusion? It is an unshakable and irrational beliefs in something untrue. Delusions defy normal reasoning and remain firm even when overwhelming proof is presented to disprove them. Delusions is a false belief or impressions that continues to be maintained despite reality contradicting it. People suffering from delusions are living in an alternate reality. Delusions are often reinforced by misinterpretation of events. Many delusions also involve some level of paranoia. For example, someone might contend that the government is controlling our every move via radio wave, despite evidence to the contrary. Next is hallucination. A psychosis causes false or distorted sensory experience that appear to be real. Psychotic patients often see, hear, smell, taste, or feel the things that are not there. Sensory experiences that appear real but are created by your mind. They can affect all five of your senses. For example, you might hear a voice that no one else in the room can hear or see an image that is not real. Disorganized speech. Psychotic patients often speak incoherently, using noises instead of words and talking in unintelligible speech patterns. This is a symptom that is mostly associated with thought or perceptions disorder. Disorganized speech is one of the main symptoms of certain forms of schizophrenia, although any condition that impairs thought can cause these symptoms. Next is catatonic behavior. Behavior that is completely inappropriate to the situation or environment. Catatonic patients have either a complete lack of or inappropriate excess of motor activity. It is an exaggerated movements, loss of normal movements leading to muscle rigidity. The causes of catatonia are acute psychosis, brain trauma, neuroleptic malignant syndrome, non-convulsive status epilepticus, and vegetative state. The main symptoms of psychotic disorders are delusions and hallucinations. There has to be medical evidence that the symptoms are a direct physiological consequence of a medical conditions. There are many medical conditions that can cause psychotic symptoms. These medical conditions include epilepsy, multiple sclerosis, central nervous system infections, and migraines. There are two subtypes of this disorder. Two subtypes are delusions and hallucinations. Now we are going to give different types of delusions. First is bizarre delusions. A delusion that is very strange and completely implausible. Example of bizarre delusions would be that aliens have removed the affected person's brain. Next is non-bizarre delusion. A delusion that, though false, is at least possible. For example, the affected person mistakenly believes that he is under constant police surveillance. Next is mood congruent delusion. Any delusion with content consistent with either a depressive or manic state. Example, a depressive person believes that the news anchor on television highly disapprove of him, or a person in a manic state might believe he is powerful deity. Next is mood neutral delusion, a delusion that does not relate to the sufferer's emotional state. Example, a belief that an extra limb is growing out of the back of one's head is neutral to either depression or mania. Next is nihilistic delusion. A person with this type of delusion may have the false belief that the world is ending. Next is delusion of control. This is a false belief that another person, group of people, or external force controls one's thoughts, feelings, impulses, or behavior. Delusional jealousy. A person with this delusion falsely believes a spouse or lover is having an affair. Next is delusion of guilt or sin. This is a false feeling of remorse or guilt of delusional intensity. Delusions of mind being read. The false belief that other people can know one's thoughts. Erotomania. A delusion where someone believes another person is in love with them. Delusions of reference. The person falsely believes that insignificant remarks, events, or objects in one's environment have personal meaning or significance. Grandiose delusions. An individual is convinced he has special power, talents, or abilities. Sometimes, the individual may actually believe he or she is a famous person or character. Religious delusion. Any delusion with a religious or spiritual content. This may be combined with other delusions such as grandiose delusions. Somatic delusion. A delusion whose content pertains to bodily functioning, bodily sensations, or physical appearance. Usually, the false belief is that the body is somehow diseased, abnormal, or changed. Persecutory delusion. These are the most common type of delusions and involve the theme of being followed, harassed, cheated, poisoned, or drugged. Conspired against, spied on, attacked, or obstruct in the pursuit of goal. Next is delusions of poverty. The person strongly believes that he is financially incapacitated, although this type of delusions is less common now. It is, however, interesting to note that it was particularly widespread in the days before state support. Last is delusions of parasitosis. A delusion in which one feels infested with an insect, bacteria, mites, spider, lice, fleas, worms, or other organisms. Hallucination. It can occur in any sensory modality. Olfactory hallucinations, especially those involving the smell of burning rubber or other unpleasant smells, are highly suggestive of temporal lobe epilepsy. May vary from simple and unformed to highly complex and organized, depending on entomological factors, environmental surroundings, nature, and focus on the insult tethered to the central nervous system, and the reactive response to impairment. Hallucinations also differ from delusional perception, in which a correctly sensed and interpreted stimulus is given some additional significance. Causes of psychotic disorder due to medical conditions. Trauma and stress can induce a short-term psychosis known as brief psychotic disorder. Psychosis can also occur as a result of an organic medical condition. A change in brain function is thought to occur with brain tumors, traumatic brain injury, epilepsy, autoimmune disorders, thyroid disease, Huntington's disease, central nervous system infections, cerebrovascular disease, auditory or visual nerve damage, multiple sclerosis, stroke, migraine, and other medical conditions. The functional causes are brain tumors, drug abuse, amphetamines, brain damage, schizophrenia, bipolar disorder, severe clinical depression, severe psychosocial stress, some focal epileptic disorder, especially if the temporal lobe is affected, exposure to some traumatic event, abrupt or over-rapid withdrawal from certain recreational or prescribed drugs, sleep deprivation. These are the general medical conditions. First is neurological disorder. Is any disorder of the nervous system structural, biochemical, or electrical abnormalities in the brain, spinal cord, or other nerves can result in a range of symptoms. Next is brain tumor. A brain tumor is a growth of cell in the brain that multiplies in an abnormal, uncontrollable way. Next is dementia with Lewy bodies. Lewy bodies is the second most common type of progressive dementia after Alzheimer's disease. Hallucination may be one of the first symptoms, and they often recur. They may include seeing shapes, animals, or people that are not there. Causes is characterized by the abnormal buildup of proteins into masses known as Lewy bodies. Next is multiple sclerosis. It's primarily an inflammatory disorder of the brain and spinal cord in which focal lymphocytic infiltration leads to damage of myelin and axons. Next is sarcoidosis. It's a rare condition that causes small patches of red and swollen tissues, called granulomas, to develop in the organs of the body. It usually affects the lungs and skin. The symptoms of sarcoidosis depend on which organ are affected. Next is Lyme disease, a tick-borne disease caused by bacteria called Borrelia burgdorferi. The treatment from medical professional is advised. Required lab tests or imaging. Can last several days or weeks. It is transmitted through tick bites. Next is syphilis, a highly contagious sexually transmitted bacterial infection, transmitted through sexual contact. Common for age are 18 to 35 years old, more common in males. Next is Alzheimer's disease. Alzheimer is a type of dementia that affects memory, thinking, and behavior. Symptoms eventually grow severe enough to interfere with daily tasks. Next is Parkinson's disease, a chronic and progressive movement disorder. The treatments can help manage condition or no known cure. Can last several years or be lifelong. Common age are 60 and older. More common in males and may be dangerous or life-threatening. So what is psychoactive drugs? Various psychoactive substances have been implicated in causing exacerbating and precipitating psychotic states. Psychoactive drugs are found in a number of medications as well as in alcohol, illegal and recreational drugs, and some plants and even animals. You should also beware that taking prescribed psychoactive drugs in ways other than intended. For example, taking drugs that have been prescribed for someone else. Group of psychoactive drugs include stimulants, depressants, hallucinogens, and marijuana. An early phase of schizophrenia. Because of the similarities between brief psychotic disorder, schizophreniform disorder, and schizophrenia, many clinicians have come to think of brief psychotic disorder as being the precursor to the lengthier psychotic disorder. Stress response. At times, under severe stress, temporary psychotic reactions may appear. The source of stress can be from typical events encountered by many people in the course of a lifetime, such as being widowed or divorced. A stress response starts in the brain when someone faces an incoming vehicle or other danger. The eyes or ears relay input to the amygdala, a part of the brain that leads to emotional regulation. The amygdala is processing the pictures and the sounds. When she perceives danger, she automatically sends a warning signal to the hypothalamus. Last is postpartum psychosis. In some susceptible women, dramatic hormonal changes in childbirth and shortly afterward can result in a form of brief psychotic disorder, often referred to as postpartum psychosis. Postpartum psychosis is a rare but serious mental health disorder that can affect anyone immediately after delivering a newborn. Many women who have given birth will suffer minor mood swings when they have a baby, known as baby blues. Thank you for watching.